Have you ever reached for your glasses only to realize the world still looks a little blurry? Or maybe you've noticed colors aren't as bright. Reading the morning paper feels like deciphering ancient code, or driving at night has become a white-knuckle adventure. If you're over 55 or care about someone who is, these little changes might seem like just getting older. But what if they're actually warning signs that your vision and your independence are at risk? Here's a startling truth. Vision loss isn't just about needing stronger glasses. It's a silent thief, creeping in so gradually that many seniors don't notice until daily life becomes a struggle. And here's the kicker. Catching the warning signs early could literally help you live longer, safer, and more independently. So before you brush off those blurry moments or ignore that new floater in your eye, stick with us. Today, we're uncovering the 5 warning signs of vision loss every senior needs to know, and what you can do right now to protect your sight, your safety, and your quality of life. Welcome to our channel where we empower adults 55 and up to live their healthiest, happiest, and most independent lives. If you value practical advice, real-life stories, and a touch of humor, you're in the right place. Today's episode is all about your eyes, the windows to your world. We'll reveal the 5 key warning signs of vision loss in seniors, why these signs matter for your health, safety, and longevity, the most common causes of vision problems as we age, simple, actionable steps to protect your eyesight, an inspiring real-life story of resilience and hope. By the end, you'll know exactly what to watch for, when to take action, and how to keep seeing and living your best. So grab your favorite reading glasses, if you need them, settle in, and let's get started on the path to clearer, safer days ahead. Let's face it, vision changes are a normal part of aging. Maybe you need more light to read, or you hold the menu a little farther away at dinner. But here's the problem. Serious vision loss often sneaks up quietly, disguised as just getting older. Many seniors chalk up blurry vision, trouble seeing at night, or faded colors to aging, not realizing these can be red flags for major eye diseases. And the stakes are high. Vision loss isn't just an inconvenience. It can lead to falls and injuries, one of the top reasons seniors lose independence, social isolation and depression, when reading, driving, or recognizing faces becomes hard, trouble managing medications or finances, increased risk of accidents, hospitalizations, and even earlier mortality. In fact, studies show that seniors with untreated vision loss are more likely to experience depression, anxiety, and a drop in quality of life. And here's the kicker. Up to 80% of vision loss in older adults is preventable or treatable if caught early. But many eye diseases, like glaucoma, macular degeneration, and diabetic retinopathy, have few or no symptoms in the early stages. That's why knowing the warning signs and acting on them is absolutely critical. Let's break down the 5 warning signs of vision loss every senior and their loved ones should watch for. For each, we'll explain what it means, why it matters, and what you should do if you notice it. 1. Blurred or distorted vision. What it is. You notice things look fuzzy, out of focus, or wavy, whether it's the TV, a book, or faces across the room. Straight lines may appear bent or wavy, especially in the center of your vision. Why it matters. Blurry or distorted vision can signal cataracts, macular degeneration, or diabetic retinopathy, all leading causes of vision loss in seniors. If straight lines look wavy, it's a hallmark of macular degeneration, which can steal your central vision. What to do? Don't just reach for a new pair of glasses. If you notice persistent blurriness or distortion, schedule a comprehensive eye exam immediately. Early treatment can slow or even reverse some conditions. Real-life tip: keep a vision diary for a week. Note when and where things look blurry. Bring this to your eye appointment. It helps your doctor pinpoint the problem. 2. Sudden increase in floaters, flashes, or blind spots. What it is: you see new spots, cobwebs, or flashes of light in your vision, or you suddenly develop a dark curtain, blind spot, or loss of vision in one part of your eye. Why it matters: a sudden shower of floaters or flashes can mean a retinal tear or detachment, a true emergency that can lead to permanent blindness if not treated right away. Sudden blind spots could also signal a macular hole or stroke. What to do: if you notice a sudden increase in floaters, flashes, or a new blind spot, call your eye doctor or go to the emergency room immediately. Time is vision. Real-life tip: don't wait for your annual checkup. These symptoms need urgent attention. 3. Loss of side, peripheral vision, or tunnel vision. What it is: you start bumping into things, have trouble seeing objects out of the corner of your eye, or feel like your world is closing in. Why it matters: loss of peripheral vision is a classic sign of glaucoma, a leading cause of blindness in seniors. Glaucoma often has no symptoms until vision loss is advanced. Untreated, it can lead to tunnel vision and total blindness. What to do: if you notice narrowing of your field of vision, see an eye doctor as soon as possible. Regular eye pressure checks and visual field tests can catch glaucoma early. Real-life tip: ask a friend or family member if they've noticed you bumping into furniture or missing steps. Sometimes others see changes before you do. Difficulty seeing at night or increased sensitivity to glare. What it is: driving at night becomes challenging. Headlights or street lights create halos or glare. You may feel unsafe walking in dim light or struggle to recognize faces in the evening. Why it matters: night vision problems can signal cataracts, which cloud the eye's lens, or early macular degeneration. Both are treatable if caught early. Increased glare sensitivity can also point to other eye diseases. What to do: don't ignore night vision changes. Schedule an eye exam, especially if you've stopped driving at night or avoid going out after dark. Real-life tip: upgrade lighting at home. Use brighter bulbs and nightlights to prevent falls. 5. Frequent prescription changes or trouble. Recognizing faces, sure, reading what it is. You need new glasses more often, but your vision never seems quite right. You struggle to read, recognize faces, or see details, even with your best correction. Why it matters: frequent prescription changes can signal underlying eye disease, not just aging. Trouble recognizing faces or reading can be early signs of macular degeneration or diabetic retinopathy. What to do: if your glasses or contacts aren't helping, or you keep needing stronger prescriptions, see an eye doctor for a full exam. Real-life tip: bring all your old glasses to your appointment. Your eye doctor can spot patterns in your prescription changes. Other red flags to watch for: eye pain, redness, or swelling, double vision or ghost images, faded colors or trouble distinguishing contrasts, watery, dry, or itchy eyes, squinting, tilting your head, or needing more light to see. If you notice any of these, don't wait. Early action can save your sight. Most common causes of vision loss in seniors: cataracts, clouding of the lens, causing blurry or dim vision, treatable with surgery; glaucoma, damage to the optic nerve, often with no early symptoms, leading to loss of side vision; age-related macular degeneration, AMD, deterioration of the retina center, affecting sharp central vision; diabetic retinopathy, damage to retinal blood vessels from diabetes, causing vision changes or loss. Presbyopia, difficulty seeing up close, a normal part of aging. How to protect your vision, action steps. Get regular comprehensive eye exams, at least once a year after age 65, or more often if you have diabetes, high blood pressure, or a family history of eye disease. Manage chronic conditions. Control blood sugar, blood pressure, and cholesterol. Wear UV-blocking sunglasses. Protect your eyes from sun damage. Eat a healthy diet. Leafy greens, fish, and colorful fruits support eye health. Stay active and maintain a healthy weight. Reduces risk of diabetes and eye disease. Don't smoke. Smoking increases the risk of macular degeneration and cataracts. Improve lighting at home. Use brighter bulbs and night lights. Use magnifying devices and organize your space. Make daily tasks easier. Stay socially connected. Vision loss can lead to isolation and depression. Support groups help. Let's meet Helen, a 72-year-old retired teacher. Helen always prided herself on her independence. She drove to her book club, volunteered at the library, and loved reading to her grandchildren. But over the past year, she noticed the words on the page seemed blurry, colors looked washed out, and driving at night became nerve-wracking. Helen chalked it up to just getting older. But when she started bumping into furniture and needed new glasses twice in 6 months, her daughter insisted on an eye exam. The diagnosis: early macular degeneration and developing cataracts. At first, Helen was devastated. She feared losing her independence. But with early treatment, new lighting at home, and a few simple tools, a magnifying glass for reading, brighter lamps, and UV-blocking sunglasses, Helen regained her confidence. She joined a local support group, learned new ways to adapt, and even discovered audiobooks for her beloved mysteries. Today, Helen still reads to her grandkids, takes walks with friends, and shares her story to help others catch the warning signs early. Her message: don't wait. If something feels off with your vision, get it checked. You have more options than you think. Let's recap the 5 warning signs of vision loss every senior should know. 1. Blurred or distorted vision could mean cataracts, macular degeneration, or diabetic eye disease. 2. Sudden increase in floaters, flashes, or blind spots may signal retinal detachment or other emergencies. 3. Loss of side, peripheral vision, or tunnel vision, a red flag for glaucoma. Difficulty seeing at night or increased sensitivity to glare, often linked to cataracts or early macular degeneration. 5. Frequent prescription changes or trouble recognizing faces, reading, can indicate underlying eye disease. Remember, vision loss is not an inevitable part of aging, and most causes are treatable or preventable if caught early. Regular eye exams, healthy habits, and early action are your best defense. Protecting your sight means protecting your independence, safety, and quality of life. Now we want to hear from you. Have you or a loved one noticed any of these warning signs? What's your biggest challenge when it comes to eye health? Share your story in the comments below. Your experience could help someone else take action. If you found this video helpful, give it a thumbs up, subscribe for more senior health tips, and share it with a friend or family member who could use a little extra clarity. And don't miss our playlist on healthy aging and protecting your independence, linked right here on the screen. Thank you for watching, and remember, the clearer you see, the longer and better you live. Take care of your eyes and they'll take care of you.